the science guy.
That's better. So you could be wondering, what is diabetes? Well, it's the given name to a disorder in which the body has trouble regulating its blood sugar levels. There are two major types of diabetes, type 1 and type 2. What may cause diabetes? Well, type 1 is caused by genetics and unknown factors that triggers this disease. Type 2 is caused by genetics and lifestyle factors. Some of them could be diet, obesity, virus infection, age, emotional stress, and smoking. It is not known exactly who discovered diabetes, although it has been around for quite a long time now, and people from the Middle Ages have been aware of it. Among ancient civilization of Greece, Rome, and China, all of whom were aware of the disease centuries ago, but it was the Egyptians who were aware of it earlier than anyone else. Ultimately, all organs are impacted if a person is diabetic. What affects one organ affects another. Some examples of organs or organ systems that are impacted are the eyes, the kidney, the nerves, the cardiovascular system, and the endocrine system. In a normal digestive process, sugar travels from the stomach through the bloodstream to your body's muscle and fat cells. However, sugar can't enter the cell without the help of a special hormone called insulin. Insulin acts like a key, allowing the sugar to enter. Then the cells use the sugar as fuel to provide energy to the body. This causes a normal blood sugar range. Sugar enters the bloodstream, but one of two things happens. Either the pancreas does not produce a sufficient quantity of insulin to match the sugar entering the bloodstream, or the body cells do not respond to the insulin the body is producing. In both cases, the result is the same. Cell doors remain closed, causing sugar getting backed up in the bloodstream. As a result, blood sugar levels rise. Because sugars are not able to enter your body cells, your body is not getting the fuel it needs. As a result, you may feel tired or fatigued. Your body may try to dilute the excess sugar in the bloodstream by pulling fluid out of the cells. This can leave you dehydrated or thirsty. Out of 24 million people that have diabetes, 8 million of them do not know they have the disease. However, a simple blood test can be taken to find out if you have untreated diabetes. There are two known tests to diagnose diabetes: fasting plasma glucose or random glucose. One of them involves fasting and taking blood tests with an empty stomach. The other one can be taken through any time of the day. For fasting plasma glucose, a level of 126 milligrams or above on more than one occasion indicates diabetes. And for casual or random glucose, a glucose level of 200 milligrams and above may suggest diabetes. If any of these test results occur, testing should be repeated on a different day to confirm diagnosis. A medical way to treat type 1 and type 2 diabetes is by using insulin. Insulin can be injected through a needle, a pen, or a pump. Insulin pumps are great because it dispenses specific amounts of insulin to your body automatically. The typical insulin pump is attached to a thin plastic tube that has a soft cannula, which is like a plastic needle, through which insulin passes, usually above the abdomen. When you eat, you program the pump with the amount of carbohydrates you're eating and the current blood sugar, and it'll give you what's called a bolus dose of insulin to cover your meal and to correct your blood sugar if elevated. Some research has found that in some people, an insulin pump can be more effective. A doctor that specializes in diabetes is called an endocrinologist. Diabetes is a metabolic disease and is not caused by pathogens. As said again, diabetes is quite common. Celebrities like Paula Deen, Tom Hanks, and more all have it. Also, people in the history have discovered it and experienced it. For example, Egyptians, Persians, Indians, and Chinese, many more too, are just some people in history that had it. Diabetes is not communicable, but yes, it's hereditary. Adults have heart disease death rates 2 to 4 times higher than adults without diabetes. However, type 2 is recoverable. Type 1 isn't. Diabetes is pretty scary, but there are ways to control it. Having diabetes can lead to these long-term effects. And most importantly, prevention is key.
Diabetes prevention. 5 tips for taking control.
1. Get more physical activity. Research shows that both aerobic exercises and resistance training can both improve your blood sugar levels. 2. Get plenty of fiber. It promotes weight loss and makes you feel full and reduce your risk of diabetes by lowering your blood sugar level. Tip 3. Go for the whole grains. Although it's not clear, whole grains reduce your risk of diabetes and help maintain blood sugar levels. Tip 4. Lose extra weight. Every pound you lose improves your health. And lastly, tip 5. Make healthier choices. Diets may help you lose weight at first, but their effectiveness of preventing diabetes isn't their long-term effects. Instead, think variety and proportion control as an overall healthy eating plan. Thanks for watching.